Hi everyone, this is Boo and Tim. Today we're going to talk about chronic traumatic encephalopathy and concussions. So what is chronic traumatic encephalopathy, or CTE? So chronic traumatic encephalopathy is a neurodegenerative brain disease that is associated by the cumulative impact of repetitive myotraumatic brain injuries, or RMTBI. It's also connected to repetitive head trauma. Initial symptom manifests as non-specific cognitive and neuropsychiatric impairments such as depressions, heightened aggressions, and it can eventually lead to motor impairment and even cognitive impairment. It is mainly found in the brain of people who play heavy contact sport, things such as soccer, American football, or even boxing. It's also seen in military people who are more exposed to explosives. More men with perceived CTE reported more suicidal tendency than compared with those who are without it. The underlying cause at the moment for premortem neuropsychiatric problem of CTE remains uncertain. There's no diagnostics test at the moment that can confirm or exclude CTE in living people. So we rely heavily on the autopsy of the brain in deceased individuals, which reveals some pathologic changes such as the atrophy of the gray and white matter in the encephalon and the mammalian bodies, the enlargement of the third ventricles and frontal and temporal horns of the lateral ventricles, the prominent perivascular spaces. Microscopic findings include the deposition of p-tau proteins as neurofibrillary tangles. Because of these findings, CTE has been predominantly considered a tauopathy with an abnormal amount of distribution of tau in the brain. We can see this. This is also common in diseases as Alzheimer's. Okay. So, according to a study or proposal study by Nicole Reams et al. In 2016, he proposed a clinical diagnostic criteria for TES, which is traumatic encephalopathy syndrome, which is in a way an indirect way to diagnose for CTE, and it requires certain features such as persistence of symptoms longer than 2 years. No other neurologic disorders is more likely to account for all the clinical features. People who have CTE demonstrate progressive course or delayed symptom onset. They also have history of head trauma exposure, typically associated with history of concussions, but may be limited to subconcussive trauma. Supportive features include emotional dysregulation, behavioral changes, and motor disturbance.
So with one of the studies we looked at, concussions reduction in Division I and II athletes, the effects of simple cervical spine exercise regimen, looked at the changes in the cervical area, like muscle strength. So in the introductions, sports-related concussions, SRCs, are underreported, inadequately managed, and often not identified in collegiate athletes. Primary preventative medicine does not provide a clear picture of how to prevent concussions in these individuals. Protective equipment has been ineffective. Multiple concussions may lead to increased development, CTE, and associated neurodegenerative disorders. Neck strength has been identified as a potential factor in reducing concussion risk as well as neck pain. The study aimed to assess the effectiveness of a commercially available, low-cost, portable, and user-friendly pre-cervical exercise device on cervical muscle strength and range of motion, and the importance of SRCs. When we look at the methods, the research included individuals from Mercyhurst University participating in a variety various sports such as men's hockey, women's lacrosse, lacrosse, men's and women's soccer, and men's wrestling. A total of 160 subjects, that's 89 males, 73 females, successfully completed the study. Exclusions criteria that consisted of age, 18 years, a lifetime history of cervical pathology, fractures, degenerative disc disease, previous cervical spine surgery, recent cervical trauma within the last 6 months. And also moderate to severe pain with cervical range of motion, ROM evaluation. The methods continued, single arm prospective cohort design over a 12-week period. Look at the sessions, we see 3 sessions a week, 10 minutes each session. Pre-cervical muscle strength and ROM were measured at weeks 0, 6, and 12. The devices that were used, we have the NEX-X device. We have successful subject completion of the study was defined as subjects completing at least 50% of the workout protocol during the study period as self-reported by the participants. So exercise protocol. So when we're looking at the protocol, like we have over here, like flexion, extension, side bending, rotation, and retraction. Strengthening exercises included the 10 seconds of passive stretch per rep for 2 reps. We said that through the study or through the treatment plan, that would probably need to be extended. Strengthening exercises included 2 sets of 10 reps. The protocol was progressive and increased repetitions and stronger therapy bands implemented as subjects progressed through the 12-week study.
All right, when it comes to clinical evaluations, we want to look at the primary outcome, which was concussion incidence, which is self-reported by participants. Secondary outcomes included the pericervical muscle strength using the Active 5 dynamometer. And then for range of motions, we use a Halo digital goniometer. So the first image up there, the person holding a little device with her neck into it, that's the dynamometer. So they're testing her strength. And the picture below is their goni, which is the device to use to measure range of motion. All right, for our statistical analysis, very simple. The pericervical strength and range of motion were reported as means and standard deviations. There's a 2-way ANOVA to compare the data starting and at 6 and 12 weeks. Turkey multiple comparison test was used, and the alpha of 0.05. The results. So, as we said, primary outcomes is the concussion incidence. They found that it is the lowest recorded incidence of concussion in the past 8 athletic seasons, so from 2014 to 2022 at the university. As we can see here, our study was conducted in the 2021 and 22. We see the concussion incidence is actually 6.67% in comparison to all the other athletic seasons. We can see a 9.4, 22%, 11%. So for the results, this is pretty good. Okay. Moving on to the second results. So the study compared a lot of other sports, such as Tim was mentioning. We were doing lacrosse, hockeys, and everything, but this is a combined results in everything with other sports and both sexes. So when we look at a combined results, we can see that there's an obvious uptrend to the neck strength in flexion, extension, side bending left and right, and left and right rotational. We can also see for the range of motions, there's a clear indications of upward trend as well, an increase in range of motions for all the sports and both males and females. However, in side bending left and right there, and as well as extension, we did not see a lot of range of motions increase. Go ahead. So, we want to talk about software specific because it is relatable to our last lecture. So, when looking at men's soccer neck strength, we did see an increase from second test to third test. So second collection and third collection, we did see an increase. And the reason why they had a little dip here, I'll mention that in a little bit later in the limitation section. But overall, we did see an increase in strength for men's soccers when it comes to extensions, rotational, but when it comes to side bending, it is quite insignificant. But for women's soccer, we actually see significant increase in strength all across 6 planes of motions: flexion, extension, side bending left and right, and rotation left and right, which is a really good finding.
So, as far as the discussion goes, head acceleration, velocity, and discipline are associated with concussion injuries. Even small reductions in head velocity are associated with the reduced concussions. This study presents a primary prevention strategy to decrease the incidence of SRCs in male and female athletes across multiple sports. The study showed a correlation between neck strength and decreased incidence of head and neck injuries. Research has indicated that every 1 pound increase in neck strength corresponds to a 50% decrease in concussion risk.
5%, you meant 5%.
Excuse me, 5%.
So, for our limitations and critique, when we talk about reported data, we know that reported data is not always reliable. It's included biases and a lot of errors. The other limitations that we observed was the correlational. Of course, most studies only find correlations, but again, from self-reported data and correlations, it does not necessarily transfer into anything super valid, as we might say. Limited generalizability among older populations because we looked at collegiate athletes only, who are typically very healthy when they were doing the testing. This is not necessarily going to be able to generalize this data into older populations. We didn't have any control group. We did compare to previous athletic seasons. However, no control group will introduce, again, more biases. Lack of blinding and placebo group, again, is very similar to control group because students and athletes know that they're being tested for neck strength and therefore concussion. They might subconsciously trying to reduce their own risk when they're during a game. Lack of trunk stabilization during week 0 when collecting secondary measurements. Again, when we were talking about neck strength for men's soccer, we see a dip from first collection to second collection. That is because of the lack of trunk stabilization. So what ended up happening is participants use other muscles of their body, like the trunk, to compensate for the lack of neck strength. And therefore, it looks like that their neck strength rapidly decreased. The exercise protocol, as Tim was mentioning earlier in that slide, we did not necessarily agree with the intensity. We think that it might, we think that it should be increased a little. 2 sets of 10 seconds for stretching might be a little bit too low, and 2 sets of 10 repetition for a T-band exercise for the neck as well. Might be a little bit too little to increase any significant neck strengths. Okay.